Altered Physiology, Mechanisms of Disease 2, a continuation of our lecture series on the cardiovascular system. Now, here in episode 6, we will continue our discussions on blood pressure as it pertains to the clinical manifestation of hypertension, which we know affects approximately 1 in 5 Canadians and an increasing number of older adults. In this particular episode, we will specifically look at normative values, how we can define when an individual is normiotensive or has normal blood pressure versus when an individual has hypertension or high blood pressure. So here is the ideal blood pressure in healthy adults, and that is 115/75. The number on the top reflects the systolic blood pressure, so that is the higher pressure that we observe during ventricular systole or when the heart is contracting, versus diastolic blood pressure, which is during diastole or when the heart is relaxing. Now, you may be more familiar with traditional values such as 120/80. However, more recent studies suggest that lower pressures may be associated with more favorable health outcomes. Therefore, the ideal blood pressure is actually less than the traditional value of 120/80. In fact, there is a positive relationship between cardiovascular disease risk and blood pressure that occurs with a blood pressure as low as 115/75. One's cardiovascular risk will actually double for every increase in systolic blood pressure of 20 millimeters of mercury, as well as an increase of diastolic blood pressure by 10 millimeters of mercury, such that an individual with a blood pressure of 135/85 would have double the cardiovascular risk relative to an individual with this ideal blood pressure. The next screen really just highlights the normal blood pressure, so that more traditional value of 120/80. Next, prehypertension is slightly higher than normal blood pressure. However, it is not clinically significant. It is defined as 120/139/80/89. And finally, high blood pressure or hypertension is defined as any blood pressure that exceeds a systolic blood pressure of 140 millimeters of mercury over a diastolic blood pressure of 90 millimeters of mercury. When blood pressure is measured or defined, it is important to note that repetitive measures are taken on a particular occasion and can be repeated during subsequent visits using a very standard protocol. In addition, there are ambulatory blood pressure monitors that can measure blood pressure, for example, over a 24-hour period. This is particularly important among those individuals who have what we call white coat hypertension. And that is when individuals tend to have a higher than normal blood pressure during a visit with a physician or clinical staff. They are simply stressed or nervous about the visit, and therefore inaccurate high readings may result. This is why ambulatory blood pressure monitoring, which can be done remotely, may be more effective.